Welcome to everyone. I'm Kent Calder, the Vice Dean for Faculty Affairs at SAIS and Director of the Reischauer Center for East Asian Studies here at our university. And it's wonderful to engage in this dialogue. Certainly this is a critical moment in world affairs, as we all no, I just took a look at the Johns Hopkins University Coronavirus Research Center case tracker, as I'm sure a lot of you do, in that it is connected right here and is something that we're all continuously looking at. There are now over 2,420,000 confirmed cases of COVID-19, as I was just checking it, and sadly over 166,000 global deaths, one of the greatest global pandemics of the past century and more. So it's an important time, and we have today an important topic: the COVID-19 crisis. Lessons from East Asia. All of us, I'm proud to say, are faculty members here at SAIS, Johns Hopkins University. 3 of us also are East Asia specialists, and all of us have spent significant time in East Asia. There are certainly many nations examining lessons from East Asia now with respect to COVID-19. As you know, just the last couple of days, I was noticing, actually yesterday, the New York Times was noting that France is studying and adapting Singapore's new testing together approach, using Bluetooth signals to alert COVID-19 proximity. New York, as many of us know, has adopted drive-through testing from Korea. There are many examples that we could certainly use. Our focus today is examining some of the practices that are used in East Asia, introducing those, and discussing their broader relevance. I should stress from the beginning, and we certainly will come back to this, that none of us are epidemiologists. This is not a prescriptive medical discussion per se. How the focus will be on implementation. And I should stress that in the report that the Reischauer Center for East Asian Studies has just completed, we do discuss 11 practices across East Asia, which seem to have been effective and are being, many of them, widely imitated. But I should stress that these are practices that the real specialists, whom we of course feel are our colleagues and scientists from throughout the world, that they have considered to be efficacious. That our interest is the ways in which best practice is implemented or not implemented in some issues, on some issues that are of fundamental life and death importance for the world today. You might ask why it is that one talks about lessons from East Asia. Certainly, and once again, I want to stress this is not a matter of medical prescription, but certainly, as we will see in our further discussions, in several countries of East Asia, and the cases which we will look at in particular detail are South Korea, also Taiwan, Hong Kong, other cases that in some respects have similar characteristics are Japan, although Japan, of course, is a question mark, as we will see in some important ways. Singapore, which has been successful in many respects, but of course is confronting a second wave that we will also discuss. And then, of course, the great, important, and controversial case of China that we will get into. Those are the key countries that we will look at. We also will discuss some other very interesting and important cases. One of our participants, Ambassador David Shear, served as ambassador to Vietnam and knows that case well. But then there are also other cases across the region, in Indonesia, in the Philippines, in some other instances where worrying tendencies have developed. But broadly speaking, in the key countries that we want to examine in detail in terms of their implementation, rates of infection are strikingly lower than in many parts of the world. Fatality rates are also lower. And most importantly, these societies, these political economies have a stress-tested character, as we stress in the report. They've confronted crises and they've responded. And so it's qualities of their administrative and political systems, and then the way that they research best practices, that they relate to experts and get their ideas, that are some of the strongest characteristics of these particular countries. They devise and implement practices that are recognized by specialists as effective. Now, what are some of the specific practices that these countries adopt? Just briefly, I'd like to summarize a few of the things we say in our report, and our distinguished commentators will move on from there. First of all, these East Asian countries stress preparation. That involves, in many of them, experience the SARS and the MERS epidemics earlier over the past 10 or 15 years. They have stockpiles. They often have engaged in planning. In response to previous crises, they changed legislation that made it easier for them to move quickly. They have infrastructure, they have domestic supply chains, and government often tends to play an important role in coordinating supply issues. So preparation is one important trait. Secondly, and I think this analysis is relatively new, but certainly people are coming to understand, the East Asian countries that have been most successful use technology extensively, particularly digital and web-based technology. I mentioned tracing together, for example, that Singapore adopts. Korea uses digital self-quarantines. China uses Alibaba health codes. Taiwan has used digital communications very effectively. For example, face mask supply and demand information platform that helps to tell citizens where face masks are available and where they aren't. So the digital side, the technological side is increasingly important and helps to deal with some of the bottlenecks, particularly in supply, that otherwise would exist. And then finally, and this is a point that that France, among other countries, have begun to appreciate, East Asian policies are often socially intrusive toward target individuals. such as those who have been infected. But this sort of targeting, and of course there are human rights issues that we may want to debate, they have tended broadly to allow a greater social openness as a result. In Korea, for example, and we may go into this more, digital quarantine. Korea has avoided generally broad lockdowns, but the targets are monitored electronically and then they're fined for violations. Of course, China, with its Alibaba Health Code app, has other related forms which are perhaps more intrusive. So there are at least these three broad types of practices that the main countries, and as I say, this is particularly countries or societies, Korea, Hong Kong, Singapore, Taiwan in particular, that they have adopted. Some nations, Asian nations, of course, are less fortunate, and they don't have exemplary records in responding to COVID-19. Indonesia, for example, I just checked on this, the fatality rates for those with confirmed with COVID-19 are almost 9%. And that's the confirmed cases alone. And of course, testing is still limited. In the Philippines, that's over 6%. Singapore, and it has had some problems recently with guest workers, but Singapore's rate is well under 1%. And Malaysia, Thailand, Vietnam have also been doing fairly well. So the final point that I would want to make is that there are potentially economic implications to the approaches to containing pandemic that the East Asian countries have adopted. How early planning, rapid implementation, the availability of medical supplies, and the creative application of new technologies can aid countries to reduce the constraints on economic activity and minimize at the same time the costs to public health. In other words, through quick, effective action, some of these East Asian nations seem to have been able to avoid closing their economies as much, or to be able to open them earlier. So how they have made these inevitable trade-offs between public health and economic growth less painful is one major subject of interest to us, as well, of course, as this type of leadership, the role that the experts have been allowed to play, and how that has helped to produce more positive results. In other words, our major focus in this session is on the lessons that can be drawn rather than the international implications. Of course, there are great implications, and perhaps toward the end of our discussion, we can go to some of those. If countries, and East Asia, of course, doesn't have all of the cases that have been relatively successful in dealing with the pandemic. There are others like Israel, like Germany, that have also been doing very well. But there are larger implications for the world in a whole variety of ways, both in terms of practices that other countries might adopt, and also in how East Asia's relative initial success may affect its future global role. So we have an important subject today. It's our privilege to be with you in this dialogue, and I personally look forward very, very much to our discussion. Let me introduce then our next participant. And as I said, I'm proud that every single one of our participants is teaching currently at SAIS Johns Hopkins University. But let me introduce Dr. Won-Hyuk Lim, who until recently served as the Associate Dean of the Korea Development Institute School of Public Policy in Seoul, Korea, and is now teaching with us at SAIS, PhD from Stanford University, and a distinguished commentator on economic development. Dr. Lim.
Thank you very much, Dr. Calder. The basics of infectious diseases is relatively straightforward. The growth is exponential, so if left unchecked, it can easily overwhelm the healthcare capacity. So the basic prescription is bend down the curve and ramp up healthcare capacity. But the real question is how to do that, okay? And in this regard, Korea offers two interesting case studies. One failed response to MERS epidemic, Middle East respiratory syndrome in 2015, and a relatively more successful response to COVID-19 currently. So let me show you a couple of slides to showcase Korea's response. Excuse me. Okay. Right. So if you look at the screen, I hope everybody can see it. There was this prehistory of failed response to MERS, where Korea had 186 confirmed cases, which was the second largest number of confirmed cases, second only to Saudi Arabia. Okay, and case mortality was quite high, it was 38 deaths, almost 20% basically. And at the time, the problem was twofold. Korea failed to quickly identify and isolate infected people. Okay. And the second problem was that the government failed to disclose relevant information quickly to the public. So because Korea didn't have enough tests, enough ICU facilities at the time, it was very slow to identify and isolate infected people. And in addition, the government was concerned about panic among people, economic turmoil among people, and it failed to disclose information on where, for instance, the infected people were hospitalized and where they have been, which is very important in contact tracing. And based on these two painful lessons, Korea had a very different response this time around to COVID-19. In this graph, the blue line shows the number of newly confirmed cases on a daily basis. And the gray line is the number of discharged from isolation cases, basically recovered or cured cases in Korea. This is based on Korea Centers for Disease Control and Prevention daily briefing. And as you can see, there was a huge spike at the end of February, about 900 confirmed cases on that date. And it quickly declined, and now we have about 10 to 20 confirmed cases, newly confirmed cases on a daily basis. So what did Korea exactly do? Based on the failed response in 2015, Korea basically had a three-pronged strategy: test, inform, and ramp up. Okay. As far as test was concerned, when China shared the genetic code of the new coronavirus on January 12th, KCDC quickly got to work and basically specified the target gene to be identified in test kits and so on. and convened private sector firms on 27th of January, the last day of Lunar New Year's holiday, by the way, this year. And 4 days later, one of the firms, test kit firms, developed a prototype, a successful prototype for test kit. And on February 4th, there was a fast track approval for test kits. Okay, so these test kits were available even when Korea had very few, confirmed cases. The first case being a Chinese tourist from Wuhan on January 20th. Okay. Now things began to turn, quite serious, as you know. And on February 4th, the same day, Korea issues a travel ban against inbound tourists from Hubei province. So this was border control measure, but Korea was careful not to have a blanket ban on China, given close trade relationship with China, and also, reciprocity considerations as well. And in addition, quite a few people thought that border control, while effective in buying time, it might actually create a false sense of security, okay, and may actually hinder, rapid response. In addition, the next day, there was the first financial support package prepared by the government. So the response was quite rapid from the start, focused on testing and other preparations. But on February 18th, there was the infamous patient 31. She was a member of the religious sect known as Shincheonji. And it was disclosed that while she had symptoms, she went to Shincheonji church meetings, gatherings, and so on. And so there was a new added urgency about identifying and isolating infected people. And 2 days later, the first death was reported in a hospital setting. Once again, crowded conditions in a hospital could be very problematic for infectious diseases. And here, Korea responded with its readily available test kits. So Korea decided to test all 9,300 Shincheonji members of the Daegu congregation in the one of the largest cities in Korea. And then when this was deemed insufficient, 3 days later, Korea decided to test all 212,000 Shincheonji members. Right? Now, Korea had test kits available to do that. And in addition, on the same day, there were export restrictions on masks. But because things were spiking like this, the public opinion on the Korean government, on the President Moon Jae-in, had worsened. So in the 4th week of February, President Moon's approval rating had declined to about 42%. Okay. But after having gone through the peak on 29th of February, Korea once again quickly responded to the crisis. One of the problems Korea had was hospital bed shortage in Daegu, the city where more than 50% of the confirmed cases originated. So what Korea did on March 1st was to have 4 case categories for confirmed cases, from mild to moderate to severe and extremely severe. And for moderate cases, it was recommended that people either quarantine themselves at home or go to what is called the living treatment centers, hotels and training centers, converted to something like a public hospital, so that crowding at regular hospitals could be avoided, and identification and isolation of infected people could take place effectively. And in addition, as people now became quite scared about the epidemic, there was a massive demand for masks. These are not, cloth masks, but K95 or 84 masks that are much more effective against the infiltration of viruses. So on March 5th, Korean government announced a plan to have a public distribution of masks. And 4 days later, the first public masks were distributed. And companies like Toray, which provided raw material for diapers, converted their manufacturing facilities to produce materials for masks. So there was a ramping up of healthcare facilities, as well as things like masks that are needed to protect medical professionals as well as the general public. And these measures, testing, informing, and ramping up production, had a positive effect on securing public participation, which is essential to addressing epidemics like COVID-19. But even after these measures, there were still clusters of infection. For instance, on March 9th, there was a call center that reported a massive number of cases of infection. Call centers by nature have sort of crowded working conditions, and workers don't wear masks when they consult with callers and so on. In addition, on the same day, Ministry of Ocean and Fisheries reported a cluster of infections as well. Government ministry having a massive cluster of infections as well. Once again, the previous strategy against Shincheonji cluster was deployed. So all members of the call center, all employees of the call center were tested, as well, and all government officials at the Ministry of Ocean and Fisheries were tested as well. And then even after that, there was another cluster, long-term care cluster in Daegu. And in the United States too, there are a lot of problems with nursing homes, long-term care facilities, due to their crowded conditions with relatively less mobile patients and so on. And this once again became a challenge. But once again, the Korea government and the private sector responded to this challenge. And by the end of March, there was a dramatic reduction in newly confirmed cases. And by this time, about half of newly confirmed cases were coming in from overseas, from the United States and Europe and others. On April 1st, Korean government adopted a 2-week quarantine for all inbound passengers. And 8 days later, on April 9th, no entry visas were suspended on reciprocal basis. But once again, these border control measures were carefully chosen not to cut off international travel, especially for business people and engineers and scientists and so on, in a wholesale manner. So it was selective. And finally, on April 15th, Korea had its parliamentary elections. By this time, President Moon's approval rating had increased to 59% from the low of 42% in February. And the ruling party was able to win the election quite handily. So Korea's 2 cases, 2015 and 2020, show the importance of testing and informing the public and ramping up healthcare capacity. And through these measures, Korea was able to secure public participation And that's really the key story, key lesson from Korea's response to COVID-19.
Thank you. Thank you very much, Dr. Lim. You have given us some very, very detailed and useful thoughts on the things Korea has done. As I think about the relationship, of course, to the broader issues we see here, what Korea did on the supply side, the medical supply side, the mask production, the rapid work once it had the genetic codes from China in producing testing materials, which of course Korea has also been able to supply to the United States. These sort of things, at least to me, seem very striking. As our next speaker, we have Ambassador David Shear, who, as I mentioned, served as ambassador to Vietnam and also as Assistant Secretary of Defense for East Asian Pacific Affairs. In his distinguished career in the State Department, he also served on China policy. He knows the case of China well. He served in Japan. He has a very broad background across the region, and many things I think that will enlighten our discussion today. Ambassador, I also should mention, is in the case of everyone else, that he currently teaches at SAIS, and he's also a SAIS alum. Ambassador Shear.
Thank you very much, Kurt. I just want to make a couple of general observations on the subject of lessons learned based on the great study that the Reischauer Center has produced. First of all, it's still early. We don't know to what extent the virus will bounce back or where it might bounce back, although Kent's comments indicate that it's already maybe bouncing back in Singapore. So not all the data is in, but it's never too early to start looking at lessons learned. Second, I think our findings explode the notion that authoritarian countries are better at controlling a pandemic than democratic countries are. 3 or 4, it could be argued, of the countries we've looked at are thriving democracies, particularly Japan, Korea, and Taiwan. They have addressed the problem of the virus pretty effectively, particularly as Wan-Hyuk's presentation suggests, the ROK. Not only has the ROK effectively managed the virus, but also, as Wan-Hyuk mentioned, they have successfully conducted a National Assembly election on April 15th that saw a 66% voter turnout, which I think is extraordinary. And the ROK should be congratulated for that, in addition to being congratulated for its handling of the virus. Thirdly, I think that while authoritarian countries may not be any better or could be worse than democracies at managing the pandemic, it's clear that countries with more cohesive societies are better at controlling the pandemic. Countries that are capable of implementing whole of society approaches seem to be flattening the curve more effectively. Fourthly, I think, as Kent suggested in his remarks, the trade-off between public health and economic growth is real, but it's not a zero-sum game as some people in the United States seem to be making it out to be. You can reopen your economy if you have adequate diagnostic tools, for example, if you have a rigorous approach to managing the virus, and if your lines of authority are clear, if your government messaging is clear. Fifthly, China may have implemented successful containment policies once it got started, but its lack of transparency, its dubious statistics, and lack of official initiative at the local level all limit China's appeal as a model. Furthermore, while China has clearly stepped out in front in implementing technological approaches to controlling the virus. There's certainly, on the American side, there would certainly be privacy issues related to implementation of a technology like Alibaba's health code. Alibaba's health code sort of ranks with social credit score as an invasion of privacy from the American perspective. And it's not clear to me that that would be, and it has some problems as well. It's not clear to users why they've been ranked as they have on the coronavirus spectrum. So, or it's not clear to users how they can change their rating on the coronavirus spectrum. So it's not clear to me that that technology will have wide appeal. As I suggested earlier, I think that clear lines of authority and clear, consistent government messaging have also contributed to successful efforts. And that's something I think the Americans can pick up a lot from. Finally, I'd like to see how countries with universal health care did compared to countries that may not have universal health care. And certainly that's something from which Americans can learn a lot. Thank you very much.
Thanks very much. Thanks for all those insights. And you certainly have raised some issues like the question of universal health care that we will want to get back to. The one thing to me out of this, and I hope we come back to this, is the implications of the kind of political system that a country has in terms of their ability to deal with pandemic. You noted that several of the countries that we talk about actually do have democratic governments. So democracy and ability to respond are not necessarily contradictory, as we saw in the case of Korea and certainly in other cases as well. An intriguing question, you began to touch on it, but it's a question that I know that our next speaker is a global expert on, and I'm sure that he can elaborate. Namely, the nature of the decision-making processes that prevail in making crucial health policy decisions, such as we are confronting now. How is it that we get the real experts in who know the healthcare issues the best into a position to decide when are they in that position, when are they not? Of course, he has many other insights to share, but Professor Jeremy Schiffman, he's currently serving as a distinguished Bloomberg Distinguished Professor of Global Health Policy at the Bloomberg School of Public Health here at Johns Hopkins. And also, I'm happy to say, is a colleague of ours at SAIS Johns Hopkins as well. So he specializes on the policy side of healthcare. He has a new piece for those of you who are interested that just came out. I think this was last Friday or so, was it, Jeremy?
Yes.
In Lancet, which is one of the preeminent medical journals worldwide relating to some of the issues that we're considering. So, Professor Schiffman, we look forward to hearing from you.
Well, thanks very much for inviting me to participate, Professor Calder. I want to compliment the Reischauer Center on its report on lessons from East Asia for the COVID-19 crisis, because it's very well done, and I encourage that it be widely read. So unlike the other members of this panel, I don't have strong expertise on East Asia. So I'll offer a couple quick observations of a broader nature. First is to point out one factor that I suspect was particularly influential in explaining why East Asian countries responded more quickly to COVID-19 than much of the rest of the world, and Dr. Lim alluded to this. It's the past or a recent experience of social disruption caused by SARS, MERS, and H1N1. So governments and societies were already on guard when a new virus emerged, and many took it seriously. And you have to contrast that with the United States and many European countries, which haven't had recent dramatic experiences with viruses of these kinds, or not to the same extent. And that may help explain why national leaders were slow to respond, and many of them presumed erroneously the viruses were not serious threats. Second point I'd like to make is it's worth assessing which among the several factors the report identifies were most crucial in shaping the effective responses, and what that implies for the rest of the world. And it's a tricky question, and it requires careful analysis by epidemiologists, economists, and others who need to use careful methods to address those issues. But I also recognize that we don't actually have time to engage in deep analysis. The pandemic is ongoing, and we have to act even amidst uncertainty. Third is a point that Kent alluded to, is to make two observations about the politics of expertise and decision making. And it's interesting to note that the societies we're thinking about, compared to other societies, have differed in their willingness to listen to experts, to the advice of the true experts, the epidemiologists, the medical professionals who know what to do on matters of contact tracing, social distancing, testing, and so forth. So in Singapore and Korea, there seems to have been a strong willingness to do so. In the United States, many of our fellow citizens and even political leaders are ignoring that advice. So what is it about societies that make them more or less willing to follow expertise? I think it's worth raising that question and thinking about how that contributes to differential effectiveness of response. And related to this, pertaining to the politics of expertise in pandemics, it's very interesting to observe just how many people have come out of the woodwork as the pandemic has emerged to comment publicly on what works and what doesn't, and offer authoritative claims about that, including the US president, who doesn't have the requisite training to make such comments. So some of this is not a good thing. And it's probably better if some people held back so that the Anthony Fauci's and others of the world have more space in the public discourse to be heard. Fourth, and connected to this point, is how frequently political rather than public health considerations have shaped the responses of national leaders. And that applies not in East Asia and the rest of the world. So we see Xi Jinping, Chinese President Xi Jinping, initially quite slow to act, and thereafter quite busy engaging in diplomacy to restore China's image as a responsible actor. We see President Trump pointing the finger at China, and quite disturbingly pointing the finger at the WHO and wanting to defund the US contribution to deflect attention to his own missteps. We see in other countries, President Bolsonaro a couple days ago of Brazil fired his health minister who was advocating for social distancing, in contrast, contradicting the president. So all this points to the observation that political scientists who study global health policy making have long been saying that whether we like it or not, global health policy making is as much a political as it is a technical enterprise. Finally, the final point I'll make is that it's worth raising the question that emerges not only lessons of East Asian policy for the response to COVID-19, but the implications for pandemic responses in the future, because this is not going to be the last pandemic. And it raises the question as to whether what we'll see is what we've seen in the past, which is an ongoing cycle of crisis, then complacency, then crisis, then complacency, a cyclical pattern, or whether the pandemic will move countries in East Asia and beyond to action to ensure that we're ready for the next pandemic. So we need to ask not just about how to address COVID-19, but how we ensure we build a global system that can systematically and rapidly address future pandemics. So thank you.
Those are all exciting ideas, and I think we can take certainly two really important ones out of that. Your crisis complacency cycle. How do we get out of this kind of a cycle? How do we learn from mistakes that we might have made in the past to produce more coherent responses in the future? Dr. Lim noted some of the ways that Korea reflected on the SARS case and then came back and was able to do a bit better. That question, maybe as a way to start out our broader discussion. And before I do that, I did want just to introduce our additional participant, Neve Denny, is the coordinator of the Reischauer Center for East Asian Studies and has done a tremendous job in helping together with our researchers. I should also mention in the group which produced this report, we have outstanding researchers. You'll find their names in the written version of the report, and we're very grateful to them. But with that, Dr. Lim, Professor Schiffman raised this question of the crisis and complacency cycle. How did Korea do that concretely? What did it do institutionally and legally to learn from the mistakes that it had made in the past? And do you think this what was the role of experts in that? Right. And then is this somehow relevant to the United States? I wonder if you could give us some thoughts.
In 2015, government officials thought that if they released information on infected people, that would actually lead to public panic and economic turmoil, right? So at the time, political considerations and economic considerations trumped expert opinions in Korea in 2015. But the net result was that, when people are infected in hundreds, right? And people die, more than 20% of the people basically died in 2015. Not disclosing information actually causes more panic and more economic turmoil. So that lesson was learned, quite well. And this time around, government officials and politicians took a step back and let the experts, Tony Fauci's of the world, take the lead in designing responses to COVID-19. And also, after 2015, an infectious disease division was set up at the Centers for Disease Control and Prevention in Korea. Okay. The KCDC was initially set up after the 2003 epidemic, SARS epidemic, but even in 2015, it still lacked institutional capacity with regard to infectious diseases. So after the MERS epidemic in 2015, institutional capacity at KCDC was strengthened. In addition, legal provisions were added. Infectious Disease Control and Prevention Act now included provisions about stronger contact tracing. And as I mentioned in my presentation, things like fast track approval for test kits were introduced as well. So those were some of the institutional and legal measures that were adopted after 2015, learning from the crisis and the failed response.
Thank you very much. I wonder, does anyone else have any thoughts on that issue of how do we get out of this crisis and complacency cycle, especially what kinds of innovations, help us to do that? Yeah, yes, Ambassador Shear.
Yes, I think intensified international cooperation will be key to overcoming this crisis complacency cycle. Unfortunately, on this score, the United States, I think, has only mixed results. On the China side, in a case in which we should be cooperating very closely with the Chinese, we withdrew our CDC personnel from Beijing, and the pandemic, despite the fact that it would provide, under normal circumstances, would provide us with a golden opportunity to increase cooperation, bilateral US-China relations appear to be deteriorating significantly, particularly since the onslaught of the crisis. Meanwhile, on the Vietnamese side, with which I have some experience, US-Vietnam cooperation on combating infectious diseases in general and the coronavirus in particular has been very close. Vietnam has not only been effective in managing and transparent in managing its crisis domestically, but it's been very good at cooperating internationally, particularly with the United States. The US has, I believe, over 100 CDC personnel stationed in Vietnam, some of whom are embedded in the Ministry of Health. And I think we'll need to look at how we've accomplished cooperation with Vietnam and hopefully generalize it, including with China, to avoid future crises like this.
If I recall correctly, the Vietnamese health minister is also doubling as deputy prime minister. Do you think that's been helpful in helping Vietnam to deal with the crisis?
Well, I think it's been helpful in two ways. Deputy Prime Minister Vu Duc Dam certainly has the prestige and the political clout necessary to make hard decisions and impose difficult policies. But he's also personally, individually, very competent. He's a technocrat. He listens to experts, and it's quite clear that he has helped Vietnam implement a very strongly science-based approach to managing the virus.
Yeah, I was quite struck in learning a bit about the Singapore case that the head of the National Research Council actually in Singapore is an MD. And of course, Singapore has had problems with the guest workers, infections, and so on. But in terms of, trying to find a niche on the medical supply side, Singapore has been actually very astute. So they have found ways to include experts in their policy process as well. So the point that Professor Shipman made there seems to me, it certainly has been important in several of the cases we have in East Asia. Maybe
Could I make a comment on this question too, the politics of international cooperation?
Sure.
I think I want to build on Dr. Lim and Ambassador Shear's comments because I think it's worth thinking about three political arenas. One is the politics of international organizations. The second is politics among nation states, and the third are domestic politics. And if you want to build a global system that works to address the next pandemic, you have to think about how to reform dynamics in each of those. And specifically what I mean by that, defunding the WHO is a very bad idea. It has to be at the center of the response. It has requisite and very important global expertise. And so it has to be central to any global response. That being said, the WHO often works at the behest of nation states, and it cannot compel powerful country governments to do whatever is recommended, which speaks to the need for, as Ambassador Shear was speaking about, international cooperation and systems that work with the WHO to ensure that China, the United States, Russia, other nation states cooperate. But thirdly, that then depends upon domestic politics. And given present Chinese and US domestic politics, it makes it all the more difficult. So one will have to hope for reforms in the domestic political dynamics too. So I just would point to those three arenas and political considerations.
Thank you. I am conscious also of comments that we're getting from our participants, and we certainly want to address as many of those issues as we can. One that just came in that relates very much to this discussion is the issue of homogeneity. One of our participants asked, does social homogeneity help to produce effective responses in East Asia? Perhaps they were thinking of countries like Korea or Japan, or maybe in particular those true. But what about this question of homogeneity? Is this part of the reason why East Asian countries have responded relatively effectively? I guess maybe Dr. Lim, do you have it, or anyone have thoughts on that?
Well, I would argue, even though societies are relatively homogeneous in Korea and Japan, Japan's response was hampered by its political considerations, especially with regard to the Tokyo Olympics. Okay? So it was only after postponing the Tokyo Olympics announced on March 24th that Japan scaled up its testing, right, and is responding actively now. So I don't think homogeneity itself is such a crucial variable. If you look at countries like Germany, Germany has done quite well. I mean, it's a more diverse society than country like Korea or Japan is. I think what mattered most was sort of a fact-based, evidence-based approach, and politicians' ability to listen to experts and actually look at and not underestimate the danger of the epidemic like COVID-19.
Okay, thank you very much. Ms. Denny, Neve, you had something that you'd like to add on that point? I know you've spent quite a bit of time in Japan.
I would say that homogeneity is important, but only if the government has clear protocol for the people to follow. As Professor Lim has pointed out, Korea was the perfect case study for getting testing, for passing out the location of people. And Professor Shear prevented the contrast to that, in that Alibaba tried to create an app that shows us that we don't have the information. And even if people wanted to improve, they don't know how. So it's not just a matter of the society wanting to show that they know how to move forward. It's having the information and having the ability to do so.
Mm-hmm. Thank you very much. Yes, that certainly is an important point. A little bit earlier, David Shear raised a question in his early remarks. Again, it had to do with the broad social parameters. These, I suppose, are domestic policy parameters, namely universal health care. How, and we do have some countries that we're looking at, for example, Japan, that has universal health care. And Korea? Does Korea have something like that, Dr. Lim?
Yes, Korea has universal health care. Yeah.
And China, of course, falls into that. Most of the countries in question do. Singapore has a rather complex system, universal on some of the very basic parameters, but without terribly large reimbursements. So broadly, most of the East Asian nations do have something close to universal health care. How important is this, do you all think, as a factor in accounting for relatively quick policy responses? Anybody have
Can
any?
I speak?
Please, yeah.
Yeah. Well, I think universal healthcare helps, but it's not a sufficient condition. If you look at countries like Italy, Spain, Britain, they have fairly universal healthcare systems, right? Good. But the key point was that the number of hospital beds, per capita, and things like supply of, or the procurement of medical supplies were problematic in these countries. And especially when they failed to test and identify and isolate infected people relatively early in the process, their healthcare system was pretty much overwhelmed by the massive increase in infections. So yes, universal healthcare would be better than not having universal healthcare, but it's not enough, because you also have to make sure that the supply of personal protective equipment, masks, ventilators, and so on is secured as well. And that requires some sort of reserve margin or manufacturing base that's readily available for the country in a time of crisis.
Of course, several of the East Asian countries they responded rather effectively in the very early stages. I think we have that general point, and that certainly is something that we stress in our report as well. We now are in several cases also approaching a so-called second wave. Korea's had a bit of this. Certainly Singapore, as we've said, among its guest workers has had a significant increase in infections. Any thoughts? I think, Niamh, you had something to add on this question of the second wave and the way that countries have responded to that.
Yes, thank you very much. I would like to ask Professor Lim, Professor Shear, and Professor Schiffman specifically if they see any ways in which these countries have been successful and what they should continue to do, but also what are the negative lessons we have learned. I think we've talked a lot about the positives, but what are some of the things that these countries should change so that when the second wave comes around, they have a more cohesive plan and a more rapid response? So I guess we could start with Professor Shear.
Okay, Dave.
I'd like to just focus on Taiwan for a moment in responding to that question. I think the current crisis provides China and Taiwan a golden opportunity to increase their cooperation, not only bilaterally, but in the context of the WHO. Of course, the Chinese have prevented Taiwan from participating in WHO activities. I think they should rethink that, and I think the pandemic gives them a good opportunity to do so. I was actually astonished when Taiwan, early in the crisis, I believe in mid to late January, sent a team of experts actually to Wuhan to survey the territory. And while the Chinese, mainland Chinese, were not 100% open with that team, I think it took back to Taiwan enough information to encourage the Taiwan authorities to act quickly and systematically to the threat. So I think China-Taiwan cooperation is important, and they could be doing more of it in the context of this crisis.
Okay, some of the other participants.
Maybe I could jump in. So that's a good good question. I mean, for the most part, this group of countries, as Professor Calder has emphasized in the report, have done relatively well. But I would point to the issue of transparency, because certainly in China, in the initial response, it did not get out quick enough. And the political calculations of local level officials silencing a group of 8 doctors, one of whom sadly passed away, contributed to delayed response. And undoubtedly, those political incentives for local level officials to avoid blame persist in China and elsewhere. Although I suggest I imagine the calculus has now shifted. If you're going to see a second wave in China, probably the incentives now are to report quickly, thankfully. But I think a longer term issue is shifts in transparency and willingness to get the information out very quickly.
Mm-hmm. Thank you. Those are all interesting points. Yes, Dr. Lim.
Yeah, because there's no known cure or vaccine against COVID-19, we have to be very careful and concerned about a possible second wave. And in Korea, for instance, there is some concern about the impact of the April 15th elections. That would become known in 1 week or 2 weeks' time. So there's a very cautious approach to expanding normal activities. And the key point here is to have extensive testing capacity that could be deployed quite rapidly against clusters of infection, as I mentioned, and make sure that there's enough capacity in the healthcare system to take care of infected people when they arrive, right? So, and eventually we'll have to have antibody testing and see how effective these antibodies are and for how long, to make sure that people are safe to resume their activities in a normal way. So there's a very kind of a cautious approach to increasing normal activities that are needed before we have a possible cure or vaccine against COVID-19. As far as the negative lessons are concerned, one lesson, at least in Korea, is maybe too much transparency, invasion of privacy. So the Human Rights Commission about a month ago said that the contact tracing information need not be so detailed as to give out, what infected people were doing and so on. So important personal details could be omitted from contact tracing reports, and just focus on where and when they have been, after being infected with the virus. So those are some of the lessons that Korea is digesting.
Mm-hmm. Okay, thank you very much. I think we also have to remember that these countries are also deeply interrelated. The ones that have been successful that we've been discussing are also, of course, economically interdependent with some of the countries that have weaker healthcare systems that might quietly be beginning to have difficulties, such as Bangladesh, or with Myanmar, or the subcontinent. This, of course, has been a major problem in Singapore in the emergence of the second wave there. One of the questions that we just got in related closely to that. They were asking, what about the developing countries with limited healthcare capabilities in the region that are also interdependent with these success stories that we're talking about? And they mentioned, for example, Myanmar or Cambodia or Laos. China, of course, has recently also had a problem with people coming across the border from Russia, which hasn't been very transparent about its own healthcare problems. So, of course, these success stories are embedded in a region that also has weaker nations. And really the question was, in a way, it moves toward the prescriptive side. And I should mention that, we are analysts of the political side of this rather than doctors, medical professionals per se. But the question was, what can the countries with the weaker healthcare systems of the region do to flatten the curve and hence improve the overall responsiveness of the region on COVID-19. I know you've spent a lot of time in Southeast Asia. I don't know. Dave, do you have some thoughts on that, or anyone who'd like to take that?
Well, I think this is where the WHO comes in. I think the WHO can provide countries like Laos and Myanmar a great deal of expertise and assistance in addressing this crisis. And I think it's incumbent on the United States to maintain its connection with the WTO. Secondly, I think G20 cooperation, both in addressing the health threats to developing nations, as well as the financial threats to developing nations, is important. This isn't the subject of the Reischauer Center study, but follow-up macroeconomic and financial measures will be increasingly important. This will require cooperation within the G20. It will also require cooperation among the world's three biggest economies, China, Japan, and the United States, as well as the EU. The G20 has conducted a virtual meeting, I believe, on April 15th, at which they agreed to implement some debt forgiveness. It will be very interesting to see how the donor countries and lenders implement that decision.
Thank you. That is a very important set of questions. We've also had some responses from participants. Perhaps we ought to spend just a moment on this question of recovery in East Asia.
Could I just jump in with one thought on this question, Ken?
Yeah, just briefly, because I did want to work in the questions that what we had. Maybe I could just present that question and then hear from you. The question really was the East Asian recovery efforts themselves. What are they doing in terms of stimulus and so on? The United States, of course, has a $2 trillion stimulus domestically, which quantitatively is unprecedented in American history, and cross-nationally as well. I think we can say that's extremely large. I was involved in a webinar across the Pacific last week, and several participants were noting the size of the American stimulus was extraordinary, both globally and nationally in the U.S. What you can additionally say, and look forward to your comments too, is that the East Asian stimuli in many cases are, I think, quite targeted in specific areas. For example, the Chinese were saying that their stimulus would include a heavy digitalization element. We talked about how digitalization is helping to deal with the pandemic, but 5G, accelerating the introduction of 5G and things like that. So killing two birds with one stone, getting economic recovery measures that also aid you in the long term, and particularly in the healthcare area. Those are some of the things the East Asians are doing. Jeremy, I'm sorry. Please go ahead.
sorry, yes. It's referring back to the previous question about the low-income countries of the region and their response rather than the one you just raised. But I just wanted to inject a quick point pertaining to low and middle income countries, including Thailand, which is middle income, Laos, Cambodia, Indonesia. There's a lot of domestic health expertise and excellent epidemiologists, very intelligent, talented officials in ministries of health. And I think that any kind of response we have to listen carefully to those folk who are deeply expert about their own societies and what needs to be done in their own systems in interaction with the WHO, CDC, and other global agencies. We must pay attention to the domestic expertise in their analysis.
Thanks very much. As long as you are on the air here, we had a question. Several people were interested in your study from Lancet. So you have a link. We can certainly provide a link regarding that. Is there anything that you could indicate to our audience generally about the link for your article?
About the messages from the article?
Yeah.
Okay. Well, I should say.
Yes, more that how could they get a copy of it and where is it?
Oh, it's presently on the Lancet website. It came out 2 days ago. It's called Strengthening Accountability of the Global Health Metrics Enterprise. And it's a critique of global efforts to create massive amounts of global health data that is useful, but sometimes, and relevant to the COVID-19 pandemic, has in some cases had the effect of disincentivizing national health officials to invest in their own national health information systems, which hamper surveillance capacity. So we have to be careful about overwhelming production of global health metrics, and invest more in national health information systems so they can collect data on COVID-19 and other pandemics. So it's on the Lancet website and you can download it for free.
Thanks very much. On this whole question of how to deal with the pandemic across Asia, one related question that we just got in regarding Malaysia, or rather malaria resistance. The countries of the region, and I suppose they were thinking particularly Southeast Asia, many of them are malaria resistant. And the question was whether that might matter or that might help them in their struggle with COVID-19. Now, that's a medical sort of question. I don't know if anyone wants to take that on.
No. That's the kind of question I think that the Anthony Fauci's of the world should answer, and we should, unless we're trained on those kind of issues, we shouldn't be commenting.
Okay.
That's just my opinion.
Well, we have had an additional issue. I've noticed we've talked about a lot of the countries across the region. In fact, pretty much all of the major countries of Asia other than Japan. And Japan, of course, is in some people's mind a question mark. Certainly, it has the homogeneity that some of our participants thought would help in dealing, cooperative action across society. Japanese people frequently wear masks. If they have an infection of some sort, they readily do that. They don't engage in handshakes and the direct physical contact that has often been associated with arising infections. But then they don't do a lot of social distancing in exactly the same ways either that is often prescribed. Japan was also relatively late in in announcing a COVID-19 crisis. The Tokyo Olympics were scheduled to be held, and many people suggest that Japan didn't want, or the leadership particularly didn't want to jinx those prospects or complicate them. A lot of factors at work. Ambassador Shear, you have spent quite a bit of time in Japan, as several of us have. Do you have any thoughts about the case of Japan? How should we think of Japan and its policies and the situation regarding COVID-19 there?
Well, Japan, just to put this in recent historical context, this is yet another natural disaster that has been suffered by the Japanese, to go along with the Fukushima earthquake and the tsunami, as well as the 1995 earthquake, the Kobe earthquake. So Japan has gotten a lot of experience with crisis management. It's not clear to me yet the extent to which the Japanese government has implemented the lessons learned. Of course, it was hampered by the problem of the Olympics in addressing the pandemic as rapidly as other East Asians have. So I think the jury is still out on the extent to which the Japanese government has effectively managed this. Although their numbers are still okay. They've experienced a recent increase in cases, but their numbers are still, the last I checked, their numbers were still relatively comparable to our okay numbers, with fewer overall deaths. So I think that the situation is mixed in Japan.
Mm-hmm. Yes, I guess from spending quite a bit of time there, that's my sense as well. They have a lot of hospital capacity. They have developed a drug that may possibly, the Fujifilm actually has done, that may well be useful in coping with this. Dr. Lim, you had something.
Yeah, I'm actually seriously concerned about Japan, because newspaper reports say that the positive confirmation rate of tests in Japan is around 50%. So there has been a lot of pent-up demand for testing, but it's now only getting to testing people. By comparison, in the United States, the positive confirmation rate is about 20%. Now, WHO recommends a level below 10% before, if you like to, reopen the economy and everything. And in Germany, it's 7%, and in Korea, the positive confirmation rate is about 2%. So I think over the next few weeks, 2 or 3 weeks, it'll be a very challenging time for Japan. And as you were mentioning, there needs to be scaling up of healthcare capacity, as well as rapid expansion of testing, if Japan is to control this epidemic.
Mm-hmm. Okay, thank you. We have one last question, and we're getting very close to our appointed hour, but I thought it was quite appropriate, namely dealing with lessons. After all, our conception in the study was lessons for other countries, generally speaking, but this asked specifically about the United States. Where are the most important lessons from East Asia for the United States? I wonder if we could have, and we literally have just 3 minutes left, if we could go around and we could hear maybe Ambassador Shear, Dr. Lim, and then finally Professor Shipman. Just
I'd say
about
clear lines of authority,
each.
unified government action, and clear messaging. are fundamentally important, and the U.S. has made fundamental errors. Particularly the Trump administration has made fundamental errors in this area.
Mm-hmm. Okay, very concise and provocative. Dr. Lim.
I would say empowering experts to design policy responses based on evidence would be the most important step. And I understand this, there may be an anti-intellectual tradition in America and everything, but when people's lives are at stake, it's important for politicians to recognize the expertise that scientists have and let them design policy responses accordingly.
Mm-hmm. Thank you. Professor Shipman.
Dr. Lim had the same one that I wanted to emphasize, and I'll just add one more. But on that same one, the flip side of listen to the experts is if you're not an expert, then be cautious about speaking publicly about what's to be done, because we're crowding the space for the Anthony Fauci's of the world, and their voices need to come through loud and clear. The second point is one for the future. The US, having experienced this, needs to prepare now for the next pandemic.
Mm-hmm. Well, I think the three of you have presented most of the ideas that I think all of us do share. And I would just like, on behalf of our panelists here, our task force members from the Reischauer Center for East Asian Studies, and our participants from throughout the world, thank you very much for joining us, and we look forward to continuing this dialogue. Thanks very much.
Thank you.